Hello, my name is Priya Das, and I'm a principal consultant at Oxford Policy Management, which is a development consultancy firm. I lead the gender and health work there, and I'm also the global focal point for gender equality and social inclusion. That's about me. So what is my leadership project? It is essentially building a community of practice of gender champions in the health system. The aim of establishing a network, the aim of the COP, which is the community of practice, was to establish a network of health practitioners, CSOs, individual institutions who are integrating gender in their health system work, primarily in the public health system. The objective of creating this network of champions was to be able to document their work and build evidence, to support and amplify their work so that it can be, more widely known and scaled, and also to develop a very strong advocacy platform for integrating gender in the health systems. The overall vision is to provide a platform where we can bring forth evidence-based, robust initiatives of integrating gender in the health system to make it much more gender responsive, both for women and for women healthcare providers. Why did I choose to do this project? So one is because we know that the health systems in India and in fact globally have a lot of systemic level gender issues, right? A core function of the health system is to provide sexual and reproductive health services to women and girls, and yet most health facilities, practitioners and system take a very medicalized approach to this and do not really focus on the intersectional gender determinants of health, health seeking or health provision. And as a result of which the quality of care remains poor and accessibility to health services for women and girls remain extremely limited. Also, the fact that 80% of the healthcare providers are women, and yet we know that they sort of work in very poor working conditions, have occupational segregation, gender pay gap, lack safety security, and a whole lot of other issues. But when we look at the initiatives that are trying to integrate gender into health systems in India, they are very few and far between. They're largely tokenistic and very limited in their approach. And yet we find that there are a number of, spread out, dispersed practices and individuals and institutions who've done some very substantive work, but are not as well known. And two, they do not have a network or a platform where they can sort of come together, consolidate work, amplify their work, and make it available for greater adoption and scaling. So how did we go about setting up this community of practice? Primarily, I leveraged an existing project within Oxford Policy Management, which was to aimed at sort of adaptive learning of integrating gender in the health systems. We collaborated with a partner organization called Quicksand, which is a design communication organization. And with them on board, we reached out to a few people who I had interviewed for a previous project and who had actually, that's where the idea had germinated, and they told me about the number of initiatives and also about the need for a network. So we established the core group, and then through them we reached out to a number of other people and sort of enlisted them as our members. We held the first convening in January 2024 to sort of look at what the COP would look like, the agenda, the function, the core structures, and then finally went on to establish a secretariat with one of our partner organizations. And since then, we have been undertaking collaborative activities. We are now trying to seek funding to sustain the community of practice, and we've leveraged each other's sort of expertise and work to really build up and sustain the community of practice. So what are we seeing in terms of the early results? In terms of the COP being established, we now have about 22 organizations as its members. As I mentioned, we have established a secretariat in Sehat, We've got 4 working groups working on different aspects of sustaining the community of practice. We've developed a funding pitch, and we've reached out to a couple of organizations for support and to sustain the COP. In terms of collaboration and convening, we have collaborated with Sehat, Women Global Health Initiative in India, TIS, and we've had 3 convenings so far. One was to establish the COP, second was to document the work and the issues around medical education and gender. And in September of 2024, we also added a new thematic to the community of practice on measurement, evaluation and learning on gender and health. And we have now a few more partners. And Quicksand has also sustained the initial virtual learning platform called Gender Collab, from where the whole idea of the COP had germinated. In terms of documentation, we've done an audio-video documentation of Mahatma Gandhi Institute of Medical Sciences initiative on engendering medical curriculum. We've also documented the session that we had on medical education and gender, and the monitoring, learning and evaluation session that we had in September. Moving forward, we have planned a convening in March. We are merging the measurement and learning group with the COP. We are looking out at each other's institutions and trying to see how we could sustain and support even without resources, if the case be. We've done some outreach with our pitches. We are identifying more collaborative efforts, and hopefully we'll get to a Gender Champions Conference at the end of the year and continue to build our partnerships. Thank you.